Hi everyone, and welcome to Children's Health Partners OSHA Training 2025. What is OSHA? OSHA stands for the Occupational Safety and Health Administration. It is an agency in the U.S. Department of Labor. OSHA's responsibility is worker safety and health protection. This is done through multiple ways. They develop job safety and health standards and enforce them through worksite inspections. They maintain record-keeping systems to track job-related illness and injury, and they provide ongoing training to increase workers' knowledge about safety and health. So as a worker, you need to know your rights that you have through OSHA. You have lots of them. Some of them include a safe work environment, information about injuries and illness in the workplace, to be free from retaliation for exercising safety and health rights, to request and participate in an OSHA inspection, and to receive safety training. For a complete list of all the OSHA workers' rights, please visit their website, which is listed there. And then also know that in the nurses station, we have an OSHA binder where in order to navigate through OSHA's website, there is more information in this binder that helps you just kind of guide through the website because it can be confusing. So our responsibilities as workers, in order to maintain a safe environment, we must report any violation to OSHA. There are certain injuries that must be reported within a certain time frame, such as a fatal injury must be reported within 8 hours. A hospitalization, amputation, or eye loss must be reported within 24 hours, and you can report these by phone or electronically. And just remember, we do follow the whistleblowing protection program, meaning that if you report any sort of OSHA violation or something that you're concerned about, you will not lose your job. You will not get in trouble for doing any sort of reporting. Okay, so with your rights, there's some general safety that is kind of common sense, but you have the right to a safe work environment, and that kind of falls on you to use good body mechanics. And at CHP, we really try to have some good workplace ergonomics, meaning that we're designing the workplace to fit the workers. So our chairs move their heights, there's monitor stands if needed, wrist pads for typing. If you're in need of anything to help with these sorts of things, please just let us know and we can assist you. Then there's the general safety of electrical safety, just being aware that if there's faulty wires or equipment that's faulty, that it's clearly labeled. Please keep all cords off the ground. And then also know that we have PPE, which is that personal protective equipment. That's including masks, gloves, eye shields. So CHP provides all of that for our safety. Your right to also have a safe and work environment is included with hazardous materials. So we have all of our hazardous materials and chemicals labeled. There is an SDS sheet for all of the chemicals and materials that are in the office. SDS is safety data sheet, and that binder is located in the nurses station. Now, if you come in contact with a chemical spill or an exposure to chemicals, you are supposed to wash and clean the area immediately. And please inform either the office manager, nurse manager, or front desk manager. The OSHA Form 301 Injury and Illness Report should also be filed. And then just know that we have that eye wash station located in the beautiful new lab area. We also use biohazard bags and sharp needle boxes. All filled biohazard bags and sharp containers, once those are filled, must be disposed of in the closet labeled on the door with the little biohazard material sticker, which is across from room 10. And then also know that we have posted in the break room the OSHA Form 300A, which is a summary of work-related injuries and illnesses, and that has to be posted starting early in the year. You also have the right to a safe work environment as far as bloodborne pathogens. So the most common bloodborne pathogens are hepatitis B, hepatitis C, and HIV. OSHA requires following the bloodborne pathogen standards, which requires the use of universal precautions. And this is an approach to infection control in which workers are supposed to treat all human blood and body fluids as if they are known to be infectious. OSHA also follows the Needle Stick Safety and Prevention Act, which was established to reduce workers' exposure to needle sticks. So we have the safe gliding needles, and you are supposed to be documenting any sort of needle sticks that do occur. As far as bloodborne pathogens, we should all be using PPE, that protective equipment, whether it's your eye shields, your gloves, your masks, and if you should come in contact with a bloodborne pathogen, again, you would wash and clean the area immediately, just like you do with a chemical spill, and then you would report it on that 301 incident form. The next right we have and what we need to know about is fire safety. So in our office, you need to know where the fire extinguishers and doors are located, which the extinguishers and the fire alarms are located by our two exits, the front door and the delivery door. As far as knowing the acronyms RACE stands for rescue. So anyone that's in immediate danger, you rescue them if you can. Alarm, so activate the nearest fire alarm and call 911. Contain means to try to contain the fire by closing the doors if you can. And then extinguish. If it's a small fire, if you think you can put it out, then you can try to extinguish it by using the acronym PASS with the fire extinguishers. So the P is for pulling that pin or releasing. There's like a latch on it. Aiming the extinguisher at the base of the fire. Then you squeeze the handle, and then the last S is sweep. So you go side to side, sweeping at the base of the fire, if you're able to do that. You also have the right to a safe work environment as far as workplace violence. So CHP has a policy regarding workplace violence. Should there be any sort of threat to CHP, this policy, for more information, is in our policy and procedure handbook. And please, it's on all of us to report any suspicious client or employee, and also know that work-related stress is a big part of workplace violence, and mental health is really important. So please contact us if you need any sort of resources to help with burnout or mental stress. Additional guidelines that CHP follows to keep all of our employees safe is TB exposure testing. So every year we do screenings done annually. We will be doing this next in June for all employees. We also have mandatory vaccinations for employees. You should be getting your Tdap every 10 years, your influenza yearly, and we do recommend COVID yearly vaccines as well. At the start of the job, everyone who starts must show proof of Tdap, Hep B, MMR, and chickenpox. So that helps to keep all of us safe. If you have any further questions, please don't hesitate to reach out. And thank you so much for taking the time to watching this for OSHA 2025. Bye.